Hi, I'm Zach McDonough, and the topic that I'm going to cover is meditation and how it can be utilized to improve sleep health, especially in cases of insomnia. This topic is most likely going to fit into the emotional domain of wellness, which involves the acceptance and expression of emotions such as happiness, anxiety, pride, and doubt. Having a good baseline of emotional wellness can also help us cope with the times when things aren't going to be so great. The lows aren't going to be so low. Emotional health is also tied to physical health, and when there is an increase in emotional wellness, we can see less impact from diseases and potentially a longer life. So, why this topic? I frequently have issues with insomnia and up to this point have relied mostly on medication to treat it, mainly Ambien and Zolpidem. Nursing school, though, has introduced many complementary interventions throughout the various classes, this one included, and I thought this might be a good first step in my personal exploration of such things. Also, when I went to my annual physical with a new doctor because of a new job, she suggested I try mindful meditation to try to treat my insomnia, as it had worked for many of her previous patients, and hopefully as a means to wean me off any sort of pharmacological interventions. And besides that, medication really shouldn't be seen as a first line long term treatment, given that its efficacy can decrease over time. It can cause unintended side effects like daytime drowsiness, amnesia, and can also cause dependencies. The other mainstay of insomnia treatment, behavioral therapies like CBT, aren't always feasible since they can require a decent amount of time and money, something that not everyone has both of. So, what is meditation? At its most simple, meditation is a centuries, if not millennia old way for us to focus or refocus our attention. What we focus on can depend on the method of meditation used. In Zen meditation, for example, one might focus on their breathing. In loving kindness meditation, the warmth that others provide us. In mantra meditation, a specific phrase or sound is repeated. And in progressive relaxation, the sequential relaxation of muscles starting at one end of the body and moving to the other. These practices can reduce negative distractions or fixations, and that is where we want to end up to help us get to sleep. So, how does it help us get to sleep? Studies have shown that there are a complex myriad of changes in the brain when a person is meditating, but these changes aren't yet fully understood. These changes, though, can lead to parasympathetic activation, otherwise known as our rest and digest mode, which causes decreased blood pressure, heart rate, respiration rate, as well as an increased amount of deep sleep during non-rapid eye movement stages of sleep. It also can shift the arousing stimuli that we might be having to deal with into mental processes, allowing for peace of mind and relaxation. It can also prevent anxiety-inducing negative thoughts from taking over the consciousness and preventing us from relaxing and being able to get to sleep. One quality that makes this intervention so attractive is that it doesn't require a substantial investment of time or money typically. You can take a 10-minute break at work, a car ride as a passenger, of course, or your bedtime routine to practice meditation. There's also smartphone apps like Calm and Headspace, YouTube videos, books, websites that can all help you find the methodology that's best going to fit your lifestyle, what works for you, and then guide you through the practice. For me, smartphone apps are probably the most enticing way to get started with meditation. Smartphones are ubiquitous in our lives now, and for better or worse, tend to go with us to bed. This can mean a less daunting start or change in routine because since our phones are so often with us, we can test the waters at our convenience. Multiple apps are available with a variety of modalities and methods. And some of those methods are specific to sleep, and others are geared more for general health. One app called Calm also offers activities such as sleep meditation, general meditation, audiobook like bedtime stories, and music for sleep. When calm was studied, all methods led to self-reported increases in ease of falling asleep, quality of sleep, and being able to stay asleep throughout the night. However, the only activity that actually led to increased metrics for mental health was meditation. If you want to see an example of what Calm has for its sleep meditation, you can follow the link there on the slide, or I'll post a copy of that URL to the discussion page. In the past few years, a couple of other interesting studies have also come out. In one, the use of heartful meditation, where one focuses on a source of light within their own heart, led to 85% of a test group composed of residents and nurses at a teaching hospital decreasing or altogether discontinuing their use of sedatives and hypnotics to treat their chronic insomnia over the course of a 12-week period. In another study, this one from South Korea, patients admitted to the ICU were shown 30-minute virtual reality videos with natural scenes and meditative music, with increased deep sleep and fewer incidents of awakening throughout the night being the result. The authors posited that the use of the VR helped to fill the need for a calm environment, something that's needed for meditation, but's probably kind of hard to come by in an ICU setting. So, for a quick summary, meditation has been around for a very, very long time, and it's practiced by many religions and cultures throughout the world. It's been shown to aid in multiple aspects of sleep health as well as mental health, both of which can be directly tied to one's physical health. Smartphone apps offer a new, enticing way to try various styles with little investment of time or money. And the ability to forego treatments with many potential adverse effects and risks of dependency in favor of a holistic practice for very little commitment seems like a win-win to me. Thank you for watching.